The number of people who've died from coronavirus in Italy has now overtaken the figure in China. In the past 24 hours, the Italy death toll has jumped by more than 400 deaths, taking it to just over 3,400. Well, across Europe, it's been another day of grim statistics and images as the virus spreads. According to the AFP news agency, more than 100,000 people are infected right across the continent. Let's take a look. We're going to start now in France, Paris. Tougher restrictions have been brought in on day 3 of the lockdown. Cycling is now banned. Any outdoor activity is restricted to just 2 kilometres from people's homes. The authorities say the initial 15-day lockdown has been extended. 372 people have now died in France. Next, let's go to Madrid in Spain, the centre of Spain's outbreak, really. Some hotels are being used as makeshift hospitals to free up space. And now let's move to Poland. These amazing pictures. This is the border with Germany, and you can see huge traffic jams. This one stretching 50 kilometres. But on the plus side, we have seen kind of positivity, I suppose, of sorts, solidarity at least. This is Verona in Italy. They've been singing and playing the national anthem there at an empty fruit and veg market. Well, let's stay in Italy. Because, of course, the nationwide lockdown has been extended there beyond next week. Northern Italy is worst hit by the outbreak. Some grim footage come out of one affected town, Bergamo. This video was posted on social media. It shows military trucks carrying coffins of coronavirus victims to other provinces because local crematoriums are just struggling to cope. Nearly 100 people have died in the town. And listen to this senior doctor from a hospital in the town.
We are in full emergency with this coronavirus pandemic. Our health personnel, nurses and physicians are working round the clock, countless hours to fight this incredible situation. We do not know how long this pandemic will last.
Tension has gone through the roof.
Lockdown is the model being adopted elsewhere. Public transport and traffic are still running, but people are only going out in urgent need. And it's orderly, with measured queues for the supermarket as people are allowed in one by one. The fruit and vegetables are stocked as normal. There's very little sense of panic buying here. And with the loo rolls, well, some brands are down, but with this level of outbreak, Italians are behaving, on the whole, rationally.
Well, let's take a look now at the rest of Europe. The EU chief Brexit negotiator, Michel Barnier, has tested positive for coronavirus. He posted this on Twitter.
Hello, and thank you for paying attention to this very personal and exceptional message. In this very deep coronavirus crisis that is touching the whole world and Europe in particular, I want to tell you that I have tested positive for Covid-19.
So face-to-face talks on the future relation.
But there have been instances in parks in Brussels where people have congregated in big numbers, either playing football or having a picnic, and it's been dispersed by the police. And the warning from the Interior Ministry here in Belgium is that you'll get 2 warnings. First of all, you'll get the initial warning, and if you're seen again, there's a €4,000 fine or a 3-month prison sentence. And the Interior Ministry is saying you should call the police if you see groups of people out of the house.
In Monaco, Prince Albert has tested positive for the virus and is now working from home. Meanwhile, the pandemic is causing a huge amount of stress on everyone. The Minister for Medical Care fainted at his lectern. 56-year-old says he was exhausted from weeks of intense work on coronavirus. More than 2,000 people in the Netherlands are infected. Right, let's move from Brussels and head to Germany, where the death rate from coronavirus is much lower than in other nationwide. The BBC's Jenny Hill has some of the answers from Berlin.
There are a number of theories as to why the death rate in Germany is comparatively low. The first is that the experts say Germany is in the relatively early stages of the epidemic. Secondly, it has a well-resourced and rather robust health system. But thirdly, and perhaps crucially, it's about, the experts say, the way in which testing has been carried out here. The authorities have in the been tested and confirmed positive so far. said all of that, they do.
In hours, the number of fatalities jumped from 200 up to 803. And that's the number of cases, 17,000 people across the country infected. The BBC's Guy Hedgecoe is in Madrid.
Here in the Madrid region, where we're seeing around 40% of all cases, and that obviously puts a tremendous amount of pressure on the local healthcare services. Now, the government has tried to take measures to alleviate that, not just here in Madrid, but elsewhere across the country, for example, by nationalising private hospitals. But it does seem to be a big problem here in Madrid in particular. Also, we have seen a number of outbreaks of the coronavirus in retirement homes. Now, elderly people are obviously a particularly high-risk group, so that could be contributing as well to that relatively high death rate. And in addition to that, there has been some criticism of Spain when it comes to its testing for coronavirus, that the testing hasn't been done soon enough, that it hasn't been rigorous enough, and therefore that when people are being hospitalised, that it's that much more difficult to cure them and indeed to save their lives.
The Tokyo 2020 Olympics is still in doubt, but the ceremony was being held behind closed doors in Japan on Friday for a simplified read. From the European Central Bank, let's take a look. It's pledged $820 billion package to ease the impact. The ECB boss, Christine Lagarde, has been tweeting, "Extraordinary times require extraordinary action. There are no limits to our commitment to the euro. We are determined to use the full potential of our tools within our mandate." So what exactly is being promised? Here's Tig Enright from the business unit.
Real echoes here of what happened during the financial crisis when her predecessor, Christine Lagarde's predecessor, Mario Draghi, talked about doing whatever it takes to support and to save the euro. The effort, the idea being that central banks, and this central bank in particular, might bend, flex, change its own rules to do whatever necessary to ensure an open question when it comes to
for nearly 2 months. The quarantine rules have been slightly relaxed in Wuhan. It is still designated a high-risk area, but people are now being allowed to walk around their compounds and exercise outdoors. South Korea, let's head over there because they're both having some success battling the virus at home. Singapore imported, and South Korea has recently been able to limit the outbreak there, but it had a sudden jump in new. Japan has only reported 3 new cases. Hokkaido is the worst affected Japanese region, but is now lifting its state of emergency, which has been in place since late February. Now, given the recent success, a growing concern in Asia is people bringing the virus back from abroad, despite having no new cases coming into the country.
Are Chinese people returning home from North America and Europe, believing that this is the safe place to be. And for that reason, the Beijing government even issued a sort of statement saying that all these Chinese students studying overseas, unless you have a good reason to, you shouldn't come back. So they're already trying to tell people they don't want them flooding back into the country because everything's kind of under control now. And imagine there have been cases of people with coronavirus symptoms who've boarded planes, they've taken drugs to suppress the conditions, so it seems like they're all right. They arrive in Beijing, somebody gives them a proper test, and they have the coronavirus. Now imagine that, again, you could be infecting everybody on that flight. You're in a...
Iran has reported its biggest jump in coronavirus deaths. 149 new fatalities have been confirmed in the past 24 hours in the Middle East.
It's more than 80 million people, and reports from many cities and smaller towns say that they don't have test kits and they're unable to test all the people who are passing away. But interestingly, Kianusha Jahanpur, one of the spokespeople for the health ministry, said that every hour 50 Iranians are being infected by the coronavirus, and every 10 minutes one person is dying. This is already a very high number, and if
530, 180 people still went outside the shrines to pray. More than 150 people have died. Washington state is the worst affected with 68 deaths. President Trump has asked U.S. health regulators to roll out.
Clinical trials are already underway for many new therapies, and we're working on scaling these to allow many more Americans to access different drugs that have shown really good promise. We've had some really good promise.
President Trump named two drugs that the Food and Drug Administration, the FDA, is currently looking at. The first is remdesivir. It's an experimental antiviral drug. It's produced by Gilead Sciences, whose headquarters are in California. And this man is the company's boss, Daniel O'Day. He was at the task force.
We need to make sure that the sea of new treatments will get the right drug to the right patient at the right dosage at the right time. As an example, we may have the right drug, but it may not be in the appropriate dosage form right now, and that may do more harm than good. Those are the things that's our job to look at, and that's why it's really important we have these dedicated professionals looking at these aspects of therapeutic development.
Well, here's an expert speaking from Palo Alto.
Activity against numerous viruses. So hopefully those studies, which have been underway now for a few weeks, also here and in China, we will have some information coming forth soon. The other drugs that President Trump were talking about, hydroxychloroquine and chloroquine, are drugs that show SARS-CoV-2 quick state.
And 4 deaths. Prime Minister Narendra Modi proportions at the BBC's Arunadhay Mukherjee in Delhi
said the symbolic day-long curfew on Sunday, the 22nd of March, from 7 a.m. to 9 p.m. will be a test of the country's resolve and show of unity. All except those involved in essential services have been urged to observe this public curfew. The Prime Minister, many observers say, used this opportunity to perhaps prepare citizens in case India has to observe a formal lockdown in the near future.
Well, let's move to Africa, which has 640 confirmed cases across more than 30 countries for disease control. Shows the spread with the darker red areas where there are more cases. Now, the continent is being warned to prepare for a big jump in. He said, wake up. Well, the coronavirus has so far temperatures is reduced in Africa due to the higher temperatures there. Other studies into flu have been going on, but all viruses are different, and this is a new virus.
People congregate either on Friday for the Muslims and over the weekend for Christians. And across the continent, there are more and more calls for religious leaders to reconsider holding big meetings. South Africa's President Cyril Ramaphosa held a meeting with religious leaders today in South Africa to urge them to do this. In Kenya, there was a similar call from President Kenyatta over the weekend, and we have seen that the evangelicals have heeded that call. Some of them will be streaming their services on Sunday. The Muslims have said that people should not go to the mosques. This is unprecedented.
Brazil is closing its land borders for 15 days, blocking entry from all of its neighbours. There we go. It's lit up with images. You may also have seen and heard this. For 2 nights now, people have been banging pots in protests. They're angry at President Bolsonaro's handling of the situation. He'd previously dismissed the coronavirus pandemic as a fantasy. Well, Katie Watson, as you can see, is in Sao Paulo. Katie, good to see you. So what are these protests all about?
Well, these protests are, they're just the anger really people feel about the way Bolsonaro has handled the coronavirus crisis so far. You may have heard just a few days ago at the weekend, there were these huge marches that were organised in support of Bolsonaro against Congress, and they'd been planned for a while. But he came out saying they need to stop, we need to call them off because of the health of. He came out, he tried to justify exactly why he went back to this.
Restrictions and measures and things that could be coming.
You mentioned there are 1 million people, but in the big cities. So certainly people are taking notice, trying to stay indoors as much.
Нужны деньги для бизнеса? Кредит для бизнеса без бумаг от ПСБ. Все.
Confirmés dans le pays, dont plusieurs cas de transmission locale. Le gouvernement congolais a pris des mesures drastiques pour tenter de contenir la propagation du virus. Tous les vols internationaux en provenance des pays à risque sont suspendus pendant 4 semaines. Les universités, les écoles, les cultes ainsi que fermés. Fin se terminer presque 2 ans après avoir commencé. Mais la RDC compte justement s'appuyer sur son expérience pour protéger sa population en poursuivant notamment les mesures d'hygiène des
En Tunisie, nous sommes pour le moment dans un état de semi-confinement. Les horaires de travail ont été aménagés pour le secteur public en séance unique avec des horaires décalés. Et puis les Tunisiens continuent par contre de fréquenter quand même pas mal les quartiers du centre-ville. J'ai pu en voir ce matin quelques-uns continuer d'aller dans les cafés qui sont ouverts jusqu'à 16h seulement. On peut voir aussi juste derrière moi une longue queue devant la banque avec mais à vous de devoir quand même aller travailler, surtout dans le secteur privé, commenter, demander des informations aux médecins qui ont mis en place.
Le président de la République a assuré que la situation est sous contrôle et qu'il ne fallait pas céder à la panique, qu'il était aussi inutile de stocker des produits alimentaires. Abdelmajid Tebboune a surtout promis d'augmenter les capacités des hôpitaux, affirmant que l'Algérie dispose des moyens nécessaires, certains n'ayant toujours pas été exploités pour faire face à cette pandémie. Le chef de l'État a même avancé des chiffres dans le but de rassurer la population inquiète. 15 millions de masques, prochain achat de 54 millions de plus, disponibilité de 2500 lits de réanimation dans les hôpitaux et des instructions pour s'en procurer 6000 autres, des promesses. Il est prêt au cas enregistré, 14 respect sans exception du confinement et des gestes barrières et autres mesures de prévention, sachant que l'État, pour le moment, a fermé les
Okay, for the second day in a row, yes, I have some good news. China is reporting no new locally transmitted coronavirus cases. Now, while it may be a major milestone in containing the virus, and it is, health experts warn China needs to be prepared for a potential second wave of infections. CNN's David Culver reports from Shanghai.
As medical personnel prepare to move out, Chinese state media say doctors and nurses in Hubei province are now beginning to scale back their life-saving efforts at the epicenter of the novel coronavirus outbreak. Now we are returning home, so I'm really excited as we won the victory over the epidemic. This met consecutive days without any new cases reported.
The single biggest danger is complacency, and this was something we talked about.
External threats. At Beijing Capital International Airport, China's CDC conducting strict screenings for international arrivals. Passengers bussed to this exhibition hall turned transit center. Health evaluations conducted at individual booths set up to represent each province. Most of Chengdu, images representing the spring-like weather. Some public parks reopened. Life cautiously resuming. The waters are calm for now, but as lockdown restrictions ease, concerns grow for a potential second
infections at this hour. And this is good news as well, only one death. So what is it doing right? For more, Taiwan-based journalist Hilton Yip joins me now via Skype. Taiwan, you're talking about a place that is a very tightly packed urban environment. It is a marvel that Taiwan managed to really appreciate it.
Ученые назвали новые симптомы заражения коронавирусом. Немецкие исследователи проанализировали подтвержденные случаи COVID-19 в стране и обнаружили ранее неизвестные проявления инфекции. О чем идет речь, узнаем у Евгения Тишковца. Он присоединяется. Почему их раньше...
19 в какой-то момент перестают чувствовать запах и вкус. А почему об этом стало известно только сейчас, самый интересный вопрос. Итак, о новых симптомах инфекции сообщили врачи из Германии, которые провели опрос среди пациентов, зараженных коронавирусом. И 2/3 больных заявили, в какой-то момент они лишались возможности воспринимать запахи и вкус. Отмечу, что подобные сообщения поступали и раньше, но что важно, тоже из Европы. Вот, например, рассказ итальянки, перенесшей коронавирус. Он появился в сети буквально на днях.
Первые несколько суток были настоящим кошмаром. Я постоянно чувствовала боль. 3 дня пролежала в постели. Не могла ничего есть, поскольку просто не ощущала ни запаха, ни вкуса.
В целом, коронавирусная инфекция у большинства пациентов протекает в легкой форме и сопровождается типичными симптомами – кашель, температура и усталость. Но есть нетипичные симптомы, которые проявляются не у всех заболевших. И что самое интересное, в разных частях света они разные. Например, в китайском Ухане в разгар эпидемии примерно у трети заболевших отмечалось затрудненное дыхание и сильная боль в мышцах, а каждый 10-й страдал диареей. В Германии случаи расстройства пищеварительной системы фиксируются втрое чаще. К этому добавляется и новый симптом – потеря обоняния. Можно, конечно, предположить, что китайцы просто... Когда мать не могла почувствовать, что ребенку пора менять пеленки, а другие пациенты отмечали, что у них изменилось восприятие пищи. Как на такое можно не обратить внимания? Почему симптомы одной и той же болезни в разных частях света отличаются? Врачам еще предстоит выяснить. Что же касается самой потери ощущения вкуса и запаха, то это, скорее всего, связано с нарушением работы клеток легких, которые...
Достаточно селективно поражает клетки легких, альвеоциты. Вот. И там начинает свое грязное дело. Клетки эти, альвеоциты второго типа, ответственны за выработку разного рода сурфактантов и слизи. И да, это клетки, которые в том числе участвуют в выработке слизи, но это не совсем те самые клетки слизистые.
Но я добавлю, что большое количество разнообразных симптомов – это само по себе опасно. Они могут пустить медиков по ложному следу и не позволить вовремя поставить правильный диагноз. Например, потеря ощущения вкуса характерна для острого вирусного гепатита, молочницы, даже обычной простуды. Это может случиться при некоторых неврологических нарушениях. А в случае с коронавирусом такое состояние еще и сохраняется довольно долго, обычно в течение нескольких дней.
Спасибо, Евгений.
Тем временем коронавирус наращивает темпы продвижения по миру. За сутки выявили более 27 тысяч новых случаев. Более 1200 человек погибли. Самая высокая смертность от Covid-19 в Италии. Там накануне число погибших превысило 3300. И теперь по этому печальному показателю Италия опережает Китай, при том, что заразившихся на Апеннинах вдвое меньше. Третье место по числу инфицированных занимает Иран. Там подтверждено более 18 тысяч случаев. Вирус уже проник более чем в 140 стран мира. Заразилось 246 тысяч человек. Более 10 тысяч погибли. Россия вводит новые ограничения на авиасообщение из-за коронавируса. Изменения коснутся рейсов в США, Арабские Эмираты и Великобританию. С сегодняшнего дня полеты возможны только в столице этих стран и только из терминала F аэропорта Шереметьево. Такое распоряжение подписал премьер Михаил Мишустин. Новые правила затрагивают Победой из Москвы и СССР. Как сообщает Роспотребнадзор, необходимые исследования проведут, цитирую, в сжатые сроки. По итогам лабораторных проверок выделят наиболее безопасные и перспективные образцы. Ученые
15 в стране и обнаружили ранее неизвестные проявления инфекции.
Tonight's CNN Facebook town hall, we want to take a moment to discuss the psychological impact of a virus that's made close contact and the comfort it can bring out of the question.
You know, coping with the stress of a disease or even the threat of it, that's an important part of how one fights illness itself. The question, though, how to do that, especially with children. So joining us is psychologist and author Dr. Gretchen Schmelzer. Welcome.
It's really importance of community. Can you just talk a little bit about what you wrote and what you want people to think about?
Some of those coping
Arrivé ce matin aux urgences de Colmar, ce patient a été intubé. Sans cet appareil, il ne peut plus respirer. Problème au service réanimation. Les 50 lits sont occupés, dont 40 par des Covid-19.
Oui, je crois qu'on n'a pas encore trouvé la place.
5 à 6 malades intubés par jour en ce moment, contre 1 en temps normal. Il faut donc trouver des lits d'urgence pour les malades dans un autre hôpital du département.
Ce qui nous manque le plus aujourd'hui, c'est des places en réanimation.
Et par ambulance. Extrêmement rare en temps normal, mais au nombre de 5 aujourd'hui. Pour ce patient, direction Strasbourg.
Pour être
Il vient dans une crise sanitaire.
L'armée au secours.
Альберт II болен коронавирусом. Анализ положительный, состояние здоровья не вызывает беспокойства. Коммунике. В общем, никого не щадит эта болезнь. Италия почти уже сравнялась с Китаем по количеству смертей от коронавируса. В Испании почти 3500 новых случаев заражения за день.
И здесь, конечно, важно понять, по какому именно пути пойдет наша страна, Россия, потому что если сравнивать Италию и Китай, Китай с 1,5 миллиардным населением потерял 3200 человек от коронавируса, а Италия, население, которое в 25 раз меньше, чем в Китае, в Италии живет 60 миллионов человек, потеряло примерно столько же, сколько в Китае человек, 2900. И как только статистика сегодняшнего дня обновится, то уже совершенно точно понятно, что Италия по количеству жертв в обязательном порядке обгонит Китай. Вот какой нам выбор?
А последние исследования в Шэньчжэне, например, показали, что дети также часто заражаются вирусом, как и взрослые, но у них наблюдаются только слабые симптомы или заражение вирусом в Италии экстремально высокое, просто пока это не обнаружено. В Германии с самого начала тестировали и пациентов с очень мягкими симптомами. У нашего типичного пациента в Бонне только першило в горле. Уверен, что в Италии на него и внимания бы не обратили.
Ну вот тоже вдумай.
Это еще и ликвидирующая возможную будущую панику.
Persistence, not politics. That's the focus of tonight's angle. I know it, watching and reading all the coronavirus coverage. I mean, I'm one of them. It gets depressing after a while. Well, the numbers around the world are still increasing. 240,000 people infected, over 9,800 dead. The elderly are living in fear. Families are wondering when the heck their lives are ever going to be normal again. And without their school routines, take it from me, I'm living with this, many children are anxious, parents just a little stressed. A restaurateur and neighbor, a dear, dear man, a friend of mine, had to let go 300 employees today. Some of these folks have been with him for 20 years. He was heartbroken. It's just light. You could see it. Look closely. It's at the end of the tunnel. Companies in the United States and elsewhere are stepping up and retooling their operations to churn out medical supplies, hand sanitizers, ventilators are forecasted through this result for the private sector to take this up, along with a massive deregulation.
We are standing up 47 sites in 12 states.
And here's some other promising news about COVID-19's mortality rate. Now, check this out. Using a slew of public and previously published information, a group of researchers estimated the probability of dying after developing symptoms of COVID-19 in Wuhan was 1.4%. Now, that number is chloroquine. All of these different antivirals have been shown fairly promising in some of the early trials, some of them in vitro. Are those the types of antivirals for the treatment, not the vaccine, that you all are looking at?
Right. Yeah, we have to be careful, Laura, that we don't assume something works based on an anecdotal report that's not controlled. And I refer specifically to hydroxy.
A drug called...
Now, after this happened, the drug company Bayer donated 3 million of the pills of this particular drug to the Trump administration. Now, although the FDA still has not approved the drug for use as a treatment for COVID-19, doctors here can still prescribe it.
That's a drug that the president has directed us to take a closer look at as to whether an expanded use approach to that could be done to actually see if that benefits patients. And again, we want to do that in the setting of a clinical trial, a large, pragmatic clinical trial, to actually gather that information and answer the question that needs to be answered and asked and answered.
Well, I have a feeling
has been the only time that we have they've been learning at home. The idea that schools are going to be closed, of course, it's a burden to your regular routine. Just trying to logistically figure out how you.
And I think they're actually going to get a lot out of it.
It's been a lot more involved.
Digitally, I would have a screen that is split, and I have 20 or 30 little thumbnails of each child. My main concern would be for the kids who are part of what we call that digital divide. The kids who don't necessarily have access to wireless or to devices. We issued some computers to children who didn't have devices. I'm concerned that there are other districts out there that may not have been as prepared as we are. We have a fantastic digital learning department.
Don't panic, but don't be an idiot. Because yeah, you could get it and you could be fine, but you could give it to your parents, you could give it to your grandparents, your aunts, your uncles, your friend's mom, Like it's not about you.
Watching NBC News now, here are the latest coronavirus headlines. The State Department is now warning Americans not to travel abroad. The global travel advisory raised to level 4. That is the highest possible because of the coronavirus pandemic. The coronavirus death toll in Italy is now greater than China's. More than 3,500 people in Italy have died from the virus. China, where the outbreak originated, reported more than help. And now you know.
In the Bronx, 463 cases. In Staten Island, 165 cases. I'm going to go through some specific issues before I turn to Dr. Barbeau, and I'll go quick here. Unfortunately, we can report that we have the first instance of an inmate on Rikers Island testing positive. The inmate is individual in his early 30s. And thankfully, at this moment, health-wise, is doing okay, is in isolation, has been moved to our communicable disease unit on Rikers Island, part of the healthcare apparatus on Rikers Island.
I know it. I've wiped out a whole generation.
A question about something that happened today, Dr. Fauci. The president said that the FDA will fast-track antiviral treatments for patients with coronavirus, saying that an anti-malarial drug would be made available, and he said that the drug would be made available almost immediately. When the public hears that, and obviously there's a lot of interest, a lot of hope in this, how much confidence should we put in that? And do we know that that drug would even work? Because, as you know, FDA Commissioner Hahn, he didn't go that far.
No. So let me put it into perspective for the viewers, and perhaps we'll understand it better. There is a drug, two drugs. They're very similar. Chloroquine, hydroxychloroquine. They've been used for decades for malaria as well as for the treatment of certain autoimmune diseases like lupus. It's a very inexpensive drug. It's tried and true. It's been around for a long time. There's been anecdotal, non-proven, anecdotal data that it works. When people give it to someone, it makes them better. But when you have an uncontrolled
advisory to the highest level. It's a level 4. CNN's Kylie Atwood joins me now from the State Department to explain. Kylie, does this mean if you go abroad for any reason, not listening to the U.S. government, you might not be able to get back into the U.S.?
It's possible. So this is the highest level of advisory regarding U.S. travel that the State Department can issue. They are telling Americans, don't travel internationally. They shouldn't take this lightly, because I want to give you a little bit of context, Jake. This is a level of advisory.
Cette petite place du centre-ville d'une des 19 communes bruxelloises est d'habitude très fréquentée, mais les mesures prises en Belgique pour lutter contre la propagation du Covid-19 l'ont rendue beaucoup plus calme, mais pas complètement déserte. Malgré cette météo très printanière, les habitants sont tenus de rester chez eux. Alors ils peuvent se déplacer pour aller au travail, évidemment, se rendre à la pharmacie, chez le médecin, dans les commerces alimentaires et puis aussi dans les librairies. Vous le voyez juste derrière moi, cette librairie peut ouvrir ses portes à des clients avec des règles strictes, pas plus de 7 personnes à la fois dans l'enceinte du magasin et puis une distance de sécurité d'au moins 1 mètre à respecter entre les clients. Alors les autorités belges n'ont pas parlé de confinement, elles n'ont pas non plus prononcé le mot de lockdown. Ça, c'est une situation que les Bruxellois ont connue en 2015 après les attentats de Paris, mais là, eh bien, même les transports publics étaient à l'arrêt. Quant aux institutions européennes, eh bien, elles aussi, évidemment, marchent au ralenti. La Commission européenne, pour le moment, maintient son point presse quotidien avec les journalistes, mais ils sont évidemment de plus en plus nombreux à avoir recours à la procédure mise en place par mail.
Ищешь машину? Скачай приложение «Автору».
Après l'annonce du premier décès lié au Covid-19, c'est l'inquiétude et les questionnements qui dominent ici à Ouagadougou, l'inquiétude chez les populations, mais aussi dans la classe politique. Rappelons juste que la première victime mortelle de la maladie était une députée de l'Assemblée nationale. Dès lors, plusieurs rumeurs visant des personnalités politiques circulaient, la dernière en date faisant état de la contamination du ministre des Affaires étrangères Alpha Bari, rumeur aussitôt démentie par l'intéressé sur ses réseaux sociaux. Mais il faut souligner que les autorités burkinabées n'ont pas attendu le premier décès pour prendre des mesures, comme la fermeture des établissements scolaires et universitaires.
Good evening. The Prime Minister says he is confident the country can defeat the coronavirus as long as everyone takes seriously the government's restrictions and instructions on how to live our lives for the next few months. Boris Johnson said he thought it would take 12 weeks to turn the tide on the virus in the UK. But he said that depended on the public following government advice, social distancing, working from home where possible, and washing our hands. Today, the Bank of England slashed interest rates to an historic low to try to shore up the economy. The number of confirmed cases in the UK rose to 3,269 today, and the death toll now stands at 144. And there was a message today from the Queen. She praised the work of scientists, medical staff and the emergency services, saying the UK was entering a period of great uncertainty. Our political editor, Laura Koonsberg, is in Westminster for us now. Laura.
Sophie, this is still a very precarious situation. The Prime Minister set out a more optimistic message to the country that if everyone does their bit, then perhaps the worst could be passed within 3 months. But there is so much still that we just don't know, so much that the government scientists can't be sure of. There is no clear, guaranteed, certain path through all of this. It's a
Sure. What is now a regular routine? The Prime Minister
turn the tide within the next 12 weeks, and I'm absolutely confident that we can send a coronavirus packing in this country, but only if we take the steps, we all take the steps that we have outlined.
You told the country yesterday.
We're all at risk as a result of it, and I don't think the government has sufficiently addressed this.
Minister John Blair.
Some form of that could come tomorrow, but it's not clear exactly what will come on.
At any time in our recent past, we all have a vitally important part to play as individuals. We will need to find new ways of staying in touch with each other and making sure that loved ones are safe. She finishes by saying, "You can be assured that my family and I stand ready to play our part."
Nick Witchell, thank you. Well, London is proving to be a hotspot for coronavirus. The number of cases and deaths is rising faster in the capital than anywhere else in the UK. The Prime Minister said there's no prospect of the government wanting to stop public
has announced an increase to 25,000 tests a day for hospital patients. As if NHS workers didn't have enough to worry about, they're confronted by this after a tiring shift.
There's no fruit, there's no vegetables. I just don't know how I'm supposed to stay healthy. And there's people are just stripping the shelves of basic foods. You just need to stop it. Because there's people like me that are going to be looking after you.
For those younger people who are continuing their social lives as normal, there was a...
Because it can lead to you getting this virus.
Pupils will get more detail tomorrow about the
assessment are likely. Today, Majda and Ewan were struggling to take.
And this might be my last day in the school, or tomorrow might be my last day, so like I might not see any of these people, any of my teachers.
After years of studying for exams, having them just cancelled has left many teenagers with a massive sense of anticlimax. And they're not just missing exams, they're also missing out on saying goodbye to their school friends and goodbye to their school.
We'll be keeping in touch with students. The school of us have to step.
Elderly. Work's let me work from home, so I'm going to work from home some days and then go into work other days and set up a wee school in the house.
She's setting up a school.
Children saying
l'actualité du continent ce soir, une trentaine de soldats pour le Covid-19. Les détails dans un instant. La bataille sanitaire au Cameroun contre le coronavirus, une bataille menée depuis le PC de crise de Yaoundé, un centre d'appel en effervescence. Reportage à suivre dans ce journal. L'attaque a eu lieu jeudi matin dans le coin.
D'une mort et d'une dizaine de blessés. Pour le moment, difficile d'avoir davantage d'informations. Ce que l'on peut dire au moment où je vous parle, c'est qu'au Mali, ces dernières semaines, la situation sécuritaire pour les forces contre les groupes terroristes mène des affrontements en guerre asymétrique.
Ont bien lieu, les 20 000 démarches dans de nombreux pays de la planète. C'est désormais chose faite en République démocratique du Congo. 14 cas ont été recensés dans le pays uniquement.
Sanitaire, déploiement de plus de 20 personnes. Autant de bouleversements dans la vie quotidienne des Quinois. Alors, comment réagissent-ils? Comment s'organisent-ils? Nous leur avons posé la question.
Au début, c'est pas facile, hein, parce qu'on n'est pas vraiment habitué avec ces moyens de prévention. Donc, des fois, tu oublies, tu touches la bouche, tu touches les nez, et puis voilà. Donc, des fois, c'est pas facile, mais avec le temps, on va s'habituer. Voilà.
Moi, je pense que ce sont de très bonnes mesures. On devait suspendre parce qu'on ne saura plus contrôler les mouvements des enfants. D'ailleurs, chez moi, sans vous flatter, mes enfants sont déjà dans... Entre la...
Roop, please state your media outlet followed by your question.
Thank you. Good afternoon. Jim Roop with Westwood One News, and the county and the city are.
I would say that that question is probably best answered by Kevin McGowan and leadership. I mean, I think everybody right now is just really working as hard as we can to make sure that we can provide as many sheltering spaces for folks who are experiencing homelessness. And I want to differentiate that there's two efforts to both understand what the capacity is and help enhance the capacity in LA County. So I'm hoping at some point, perhaps tomorrow, he'll be able to speak with you and announce what the system looks like today and what it's going to look like as we continue to get enhanced capacity. Many people in LA County is what is happening with the number of positive cases, and we're happy to provide that information. You'll also notice we use this as an opportunity to talk about all the other issues that really we like your viewers and your listeners and your readers to pay attention to as well, because this is an opportunity, thanks to all of your cooperation, for us to be able to talk about how people can take care of themselves and the people they love and those